Hey there, it's Fiz again, and welcome to another episode of Vedicinal Chemistry. Today we're going to be talking about antibiotics and antibiotic resistance. Antibiotics are incredibly common. At some point in your life, you have most likely taken a course of antibiotics. You've probably also heard about antibiotic resistance. In this video, we are going to discuss antibiotic resistance and how you can help prevent it.
So, what are antibiotics?
Well, I'm glad you asked. Antibiotics are a class of drug used to fight bacterial infections. You've probably heard of penicillin, which is the most famous antibiotic. Some bacteria can be harmful to your health and make you feel sick, like E. coli, which causes diarrhea, and Streptococcus pneumonia, which causes pneumonia. You may have also heard of a bacteria called MRSA, or methicillin-resistant Staphylococcus aureus, which is a bacteria that causes infection but is resistant to the antibiotic methicillin. What is antibiotic resistance?
I don't have a clue.
Well, let me tell you. Antibiotic resistance occurs when a strain of bacteria can survive treatment by antibiotics.
Don't antibiotic drugs create selective pressure?
Now you're starting to get this. Antibiotic drugs put selective pressure on bacteria to evolve resistance. As bacteria are bombarded with antibiotics that kill them, the population of bacteria is pushed to find a solution. Bacteria that pick up a genetic mutation which allows them to survive antibiotic treatment can pass on that genetic mutation.
Well, what happens to the bacteria that doesn't mutate?
The bacteria that don't mutate are killed by the antibiotics and cannot reproduce. This means that only bacteria that are resistant to antibiotics can reproduce more bacteria. This leads to a population of bacteria which are resistant to the antibiotic. Patients who acquire these antibiotic-resistant bacteria cannot be treated.
So, what can I do to fix this? Take more antibiotics? Don't take medicine?
Here's what you can do to prevent the development of antibiotic resistance. Tip 1. Don't take antibiotics for a viral infection. If you are sick with symptoms like vomiting, diarrhea, severe stomach pain, severe coughing, runny nose, or congestion, chances are your doctor will prescribe you an antibiotic drug to help make you feel better in the chances that you have a bacterial infection. However, those symptoms are often very common of viral infections too. Viruses are different types of germs than bacteria and cannot be treated with antibiotics. Taking an antibiotic drug for a viral infection will not cure the infections, keep the infection from spreading to others, or make you feel better. In fact, it can actually cause side effects that will make you feel worse. Ultimately, it can lead to the development of antibiotic-resistant bacteria. When you are sick, make sure to talk to your doctor about the type of infection you have, and remind him or her that you want to take medicine that will treat the type of infection you have. Tip 2. Take antibiotics exactly as prescribed. Antibiotics are often taken as a course. One common antibiotic is the Z-Pak or azithromycin, which must be taken multiple times a day until the medication is finished. It is very important to finish the full course of the antibiotic, even if you start to feel better, before finishing the prescription. If you do not finish the antibiotics, not all of the bacteria will be killed, which can lead to the infection coming back or the development of resistance in the leftover bacteria. Tip 3. Do not take old antibiotics or antibiotics not prescribed to you. Taking old antibiotics can lead to the development of antibiotic-resistant bacteria because any leftover bacteria from the infection may have developed a resistance to the antibiotic. By doing so, it can push the 1 or 2 resistant bacteria that might be there to reproduce and create a whole population of resistant bacteria. There are many different types of antibiotic drugs, each of which works in slightly different ways. Your body also responds differently to a drug than somebody else's would. Your doctor prescribes the correct type and dose of antibiotic specifically for you. If you take somebody else's prescription, it may not kill the infection and, again, can push the infectious bacteria to become resistant. We have covered 3 simple things you can do to help prevent the development of antibiotic-resistant bacteria. 1. Do not take antibiotics for a viral infection. 2. Do take your antibiotics exactly as prescribed. 3. Do not take your leftover antibiotics or antibiotics not prescribed to you. Hey, this has been Fiz with Vedicinal Chemistry. Thanks for watching. Be sure to check out our other videos. Until next time, stay healthy, stay happy.